Oh, I guess I'm the host. Hello. Okay. Welcome everybody. I'm Dr. Lori Marbas. Usually I'm with Chef AJ. I don't know where she went, but I'm just going to share with you today about menopause and weight gain. So let me go ahead and pull up my slides here. I'm going to share my screen. Okie doke. Let me get, oh, someone came back. Okay. Host is disabled, participant sharing screen. Page.
Okay, I don't know what the heck happened, but
I don't know either. You disappeared.
I like literally, it was so funny because I disappeared, but you didn't disappear. So
I, I
let's
was
do
like,
take
oh,
two.
okay.
Okay, you're there for sure. Charles, we're live now, right? This is insane. All right, fantastic. I apologize.
That's okay.
She is crazy, but I'm so glad you're here and I'm here at the same time. If I wasn't here, I was thinking, well, she could just do the show without me because she's good enough to do that. But anyway, without further ado, ladies and gentlemen, welcome to Chef AJ Live. I'm your host, Chef AJ. This is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Today is the fourth and last Wednesday of the month, which means it's time for Dr. Lori Marbas. And today she is going to be talking about five reasons that menopause can cause weight gain. Please welcome Dr. Marvis. How are you, Dr. Marvis, today?
Great, AJ, I'm good. How are you?
Good. Well, it's so interesting because a lot of times people say the reason they can't lose weight, I hear because they have hypothyroidism or because they're of a certain age and menopause.
Mm.
So hope maybe you can shatter some myths because
Yeah,
that it
I'm,
is possible to still lose weight, when
yeah,
you're of a certain age. Because we have so many success stories on this channel, people that lost weight in their 50s, 60s, 70s, and 80s. So we know it can be done.
yeah, absolutely. I think there are some shifts that occur, like you can't do necessarily get away with as much as you did when you were younger, but being in my 50s, in the middle of menopause and hypothyroid for over 28 years, I can attest you're going to be okay. But it's nice to understand what's going on inside your body at this time.
Nice. So
Let me
teach
take,
us.
all right, let me get my screen shared here. All right, let me start the slideshow. Okie doke. So welcome everybody. Again, AJ, thank you so much for having me as always. I'm so thankful. And basically 5 reasons menopause causes weight gain, right? Just let's understand the biological and lifestyle factors that are going on inside of our body. Sometimes, women tell me they feel like there's an alien that has invaded their body and they're like, I don't know where I went. So this is kind of just a quick overview to share with you what is actually going on. So first of all, we're going to talk about what is menopause. We're going to talk about the importance of understanding weight gain during menopause in the agenda. So basically, remember, menopause is just a natural biological process, right? So it really marks the end of your menstrual cycles or your reproductive years. And medically speaking, it's diagnosed after 12 months without a menstrual period. And that usually can anywhere occur between mid to late 40s to early 50s, mid 50s. Average age is around 50, 51. And there's a lot of stuff going on here hormonally. Many women will just, glide through, which is fantastic. Even if you're doing everything right, for example, my own story is I eat a whole plant-based diet, I exercise, I mind stress, I get sleep, I do everything I tell my patients to do, but I still had some really difficult and disturbing things occur within my own body. Hot flashes, my lipid panel changed, crazy, a lot of different things. But anyway, so know that you're not alone in this craziness. So we're going to talk about a few key points here. We're going to talk about hormonal changes, muscle mass, fat distribution, lifestyle factors, and insulin resistance. And then we're going to tell you what you need to do about it. All right, let's move on. Okay, let's talk about the hormonal changes first. And I also put here on the paper, I know there's a lot of scientific minded individuals in your audience. And so I really wanted to share specifically, one particular paper or two that they could look at if they want to dive further into this. So first of all, when you think about this, with menopause, you get a huge decline, obviously, in your estrogen and progesterone as your ovaries stop producing eggs. And there's a whole physiologic process that occurs. I did a video just a few days ago on what actually causes menopause. Many people ask, am I in menopause? Do I need hormones? Again, not necessarily, get labs done, but I walk through that if you want to go further into that, but it's just basically understanding that you have a natural decrease in estrogen and progesterone. The brain is sending out another little hormone called FSH saying, hey, ovaries make more. And as that goes up, that's an indication, yes, you're heading in or in menopause. And with that, of course, drops the hormones, the estrogen and progesterone. And because of that, estrogen really plays a vital role in regulating your metabolism and your body weight. So as your estrogen levels drop, it disrupts the balance of hormones that control hunger and fat storage, which is interesting. So you can lead to an increase in appetite. You have changes in how the body stores fat, which we'll get to here in a minute. But really, one of the most notable effects is the hormonal shift is on metabolism. So it slows down metabolic rate, meaning the body burns fewer calories at rest. And then that can gradually cause a weight gain over time. But also there's a change in how the body stores fat, and especially around the abdomen. So as I was diving into this, it's interesting. So basically what happens is instead of storing as much fat in the under the skin of the subcutaneous fat, you'll see it start shift towards this abdominal fat storage or visceral fat. And there's several reasons that that occurs. It's not as nuanced as like, oh, no estrogen, it just moves. But there is a cascade of events that occurs. But the really important thing to understand is that visceral fat is really, really a concern because it's more than just cosmetic. It increases risk for cardiovascular disease and things like type 2 diabetes. So that's why it's important to understand that these hormonal shifts absolutely see a decline, or excuse me, a shift in your metabolism and also where your fat is stored, which sets the foundation for other things that we're going to talk about as well here in a minute. Okay, another thing that we see happen as we get older is decreased muscle mass, right? So this is called sarcopenia. You may have heard of this. It's basically a process that is accelerated during menopause because of decline in estrogen levels. Now, estrogen really plays an important role in maintaining lean muscle mass, and its reduction means you have a decrease in muscle protein synthesis. So you have this loss of muscle mass, which significantly decreases your metabolic rate. So remember, muscles are metabolically active tissues. I remind my patients, this is your metabolic furnace, right? So they burn calories even at rest. The muscles are just doing their thing. So when muscle decreases, the body's overall metabolic rate drops, and then that leads to fewer calories being burned throughout the day. Excuse me. This can result in weight gain, of course, if calorie intake is not adjusted accordingly. Furthermore, sarcopenia decreases muscular strength, and if you're not as physically active, which we'll get to in a minute, that can accelerate your weight gain. So that's why we are always speaking to really paying attention to some of the solutions we'll get to in a minute is how do we maintain our muscle mass? So that is the number one thing as we age, one for decreasing risk of falls, maintaining your bone strength, as you know, if you move your body, those are really important things to think about as you're in this perimenopause, menopausal stage. Did you know that, just speaking just on the side note, your bone density accelerates its loss during perimenopause. And then it just kind of levels out in postmenopause, which is after that 12 months of no period, which is crazy to think about. But anyway, so I just wanted to share the highlights here about the decreased muscle mass. And we could go into depth why this occurs, but again, I'm just kind of keeping it on a higher level for you. All right, and I kind of spoke to this a little bit with the fat distribution earlier. So basically during menopause, again, we talk about there's that noticeable shift in fat distribution from the subcutaneous fat, meaning under the skin, which is to this visceral fat, which is stored in and around your internal organs, around your liver, inside around your heart, different things like that. And like I mentioned, it's driven by the decline in estrogen. And when you have this, it becomes more inflammatory, right? So when you have this increased inflammation because the visceral fat acts differently than your subcutaneous fat. And the important thing here to understand is inflammation, as we understand, it drives chronic disease like type 2 diabetes. It drives, heart disease. One of the things I always speak to my patients is, yes, your LDL is very important when you're looking at the risk of heart disease, but so is your inflammation. So we measure things like HSCRP and understand what can we do to be decreasing the inflammation in our body. And one of those things is decreasing your central obesity or your visceral fat. And the things we're going to highlight here in a minute will absolutely help you do that. So when you have this shift, you get this visceral fat, increases inflammation, and it also increases insulin resistance, which is the next factor. The last factor. Lifestyle factors, just highlight this, as many of us understand, as we get older, maybe you had an injury, or maybe you're dealing with chronic disease, or maybe you're on medications that don't make you feel as well. You may see a decline in physical activity. Your kids are out of the house. You're not running after them as much. And that can absolutely have an impact, one, on your muscle mass, right? It also decreases your insulin sensitivity. Again, you're not burning as many calories, and you can gain more weight, especially if you're sitting and watching TV. Many times we have unhealthy eating habits that come along with that. If you're more stressed, and if you're not moving, you're not sleeping as well. Again, all of these things will have a huge impact, and it's just one layer upon another upon another. So I want to mention that as well. Let's jump on here to the next one. Insulin resistance. This is really one of my favorite things to speak about, because it really improves so dramatically and so quickly with the activities we're going to speak to here in a minute. But when you, again, mention that decline in estrogen, and then your body actually changes the way it responds to insulin. And so sometimes you'll see patients, they're doing fine, and instead like, I'm eating the same things that I did last year, but now things are different. I don't understand. Maybe they, again, may not even had some weight changes, and you'll see this change. For example, even in my own lipid panel, I didn't become insulin resistant, but for the very first time, I had labs done not too long before the menopause kind of transition set in. My LDL has always been 80 or below. And when I went through the menopause transition, as the body was shifting, holy moly, my LDL jumped above 100 for the first time in my life. And I kind of freaked out a little bit, and really got to paying attention to what I was doing, and just shifted a few things. And I decided to incorporate other things like estrogen and progesterone, because for myself, I felt that was a more important thing. And that's the other thing, is really, as we'll get to here, there may be an opportunity if you want to speak to your doctor, because when we look at the past research, especially around the Women's Health Initiative research, 20 years ago, I guess it was like 2002 when it was first reported, and now we're looking at more recent research, there's actually evidence that it can be quite helpful. So I know there's a lot of talk about medications, and you don't need medications, and you absolutely don't, to live a healthy life. But at the same time, medications can be life-changing for many people. And I will tell you, I've had many patients who are whole food, plant-based eating, healthy, they're exercising all day, but there's 30 plus different symptoms with menopause, and it can be dramatically shifting. Their quality of life is really frustrating for them. And then we do something for maybe short term or longer term, and it really shifts the way that they feel, and they can move on with their life, and quality of life dramatically improves. Again, it's independent, with each person, what we decide to do. But with that insulin resistance, of course, comes risk factors of type 2 diabetes and heart disease. There's so many things that insulin resistance drives. And I think I did a presentation with you guys all about insulin resistance as well, but I tend to go down rabbit holes. So I'm trying to keep it on a upper level here. So moving on here. So what do we do, right? So this is what I encourage patients to do. And I would encourage you to take up. And if you do decide to try a whole food plant-based diet, just a few things to keep in mind. You want to stick to foods that are whole foods, right? Foods that come as close to nature as you can. Of course, beans, you need to, to cook those and different things. But you also want to pay attention to making a variety of colors and a variety of the different plant categories, fruits and vegetables and beans and whole grains, nuts and seeds, because that variety of different types and the variety of colors will get you all the really cool, amazing micronutrients that are going to help you, one, not only with your health, but also improve your insulin resistance. It'll help you lose weight. These foods are naturally going to be lower calories. So what you're going to see is a shift in your caloric intake, which will obviously help you lose weight. And you have more energy, you feel more full because of the fiber, you're changing your microbiome. It's incredible. There's some amazing research around the microbiome of people who are thinner versus those who are dealing with obesity. And there is absolutely a difference there. So if you start eating these foods that are going to be encouraging the growth of these really helpful and healthy microbiome, that's one thing that's going to start shifting. Number two is exercise with an emphasis on resistance training or weight bearing exercises. This could be as simple as putting on a weighted vest or a backpack with some kind of, maybe a couple of books in them, and walking, right? Resistance training is also like lifting weights, but you could also do calisthenics. You could do as simple as starting with push-ups against the counter. Again, you could also get help if you have a history of osteoporosis. You definitely want to speak to maybe your doctor for referral to a physical therapist to get a program that is safe for you, especially if you have a history of any type of fractures. And so those are the things that you want to be thinking about. How often should you be doing resistance training? Probably upwards of 3 times minimally per week. Again, what should you be doing? Should you be doing a variety? What I would suggest is, when you look at the research, is that 12 to 16 weeks, you want to be consistent in the program that you're doing, and then doing progressive overload. So let's say that you're doing a deadlift, right? And then you'll just want to increase the amount that you're doing that on a regular basis, of course, safely over time, because that's when you get that consistent challenging of these big muscles. That's when you're going to get the benefit. The other thing is making sure you're really focusing in on some really healthy, rich, protein rich plant foods like your legumes and soy products, which are amazing for this type of menopause anyway, but and also your whole grains. Those are going to be rich in your protein, and they're going to be very helpful to support your muscle or protein synthesis that's occurring when you're challenging doing resistance training. Next is look at your labs. I don't think there's enough emphasis on understanding what your labs actually mean. So many times I'll have patients who will come and they're like, oh, my labs are fine. For example, their cholesterol is like, oh, my total cholesterol is under 200, or my LDL was under whatever they think it was that their doctor said it was okay. But when you look at them as a whole picture, the blood sugars started trending upwards. It's going from maybe in the upper 70s or lower 80s, and now it's trending closer to like 99, and now it's in the low 100s. And you measure an A1C and it went from 5.2 and now it's like 5.6, really knocking on, being on a pre-diabetic range. And so those are some things that you can actually look at, look at your lipid panel, look at your blood sugars and A1C. I would also look at your HSCRP, which is your inflammation markers, and just see what's going on internally. And if you struggle with understanding what those mean, I've definitely done videos around labs as well. Next, you want to speak to your doctor about treatment options. Like I had mentioned before, there may be a place for you. One, there's non-hormonal and there's hormonal treatment options for menopause if you're really, really struggling. And you obviously want to increase for example, your whole soybean consumption. I tell people now I have a couple of tiers of soy products, right? So you have the whole soybean, edamame, and tempeh. These have more of those isoflavones or those phytoestrogens that you're going to find beneficial for for menopausal relief, versus things like soy milk or tofu. You can absolutely still consume those and get some, but it's going to be about half as much as you would the whole soybean. Of course, that also gets closer to the whole food that we speak to about. Next is ensuring restorative sleep. And what I mean by that is that when you wake up in the morning, that you feel like you have actually slept. So many of my patients will come in, they're like, man, I just can't sleep. I'm sleeping maybe 4 or 5 hours a night. I'm struggling. And then that sets them up for more stress during the day. They make poor food choices, the relationships struggle. It can cause some issues with your insulin resistance, and you're more likely to gain weight. So lots of things there. And again, what's going on with your sleep? That is a very individualized discussion. But you can start incorporating things like making sure your room is dark, avoiding caffeine at least 8 hours prior to bed, not eating large meals 3 hours before you go to bed, getting rid of your screen at least an hour before bed, right? But, dimming the lights as the light goes down in the evening, dimming your lights in your home as well, right? Not those really glaring overhead lights. And so kind of mimicking what you see going on outside. It's time to slow down and, decreasing the light, thinking about, how you can build a routine around setting yourself up for sleep. But also, I'd say you'd also want to increase your sleep drive in the day, right? So when you start your morning early and you get that morning light, that's starting literally there's a cascade of events that will help you fall asleep later at night. But you also want to do things like exercise, right? You may notice that the more you exercise, the better you sleep. So that all feeds into itself. Next and final is practicing mindfulness for stress management. I would say this is the one thing that has really improved the quality of my life over the last of the few years, is just really understanding the true meaning of mindfulness, and the amount of stress over other things that used to be very bothersome for me has been tremendous. It's just a much more calming way of living. And again, mindfulness practices could start with simple as being mindful of your breathing, right? You could do box breathing, you could do 4-7-8 breathing, because when you observe your breathing, what happens is you'll notice is the chatter in your mind turns off, right? And you become present and you are aware of what's going on. And that mindfulness is that you're just being observing of what's occurring in the current and present moment. And what you'll find is that your stress levels decrease dramatically during that time. So that is really it. I just wanted to mention too, if you have any questions, feel free to ask, or you can send them also at I'm seeing patients at drmarbas.com, but I also have a free masterclass. It's called 5 Steps to Master Your Metabolism and Lose Weight. That link is on that website at drmarbas.com. And I appreciate you guys for being here.
Thank you. That was very good, very comprehensive. And I will take questions from the chat on any of the platforms, but there's one that was sent in advance. It's not exactly on weight gain, but it is from a postmenopausal woman named Bonnie.
Okay.
She says, for the past 2 weeks, I have lightly bleeding after being fully menopausal for 2 years. An
Mm.
ultrasound has indicated a possible fibroid, a cyst on one ovary, and a thickening of the endometrium. And she gives the numbers if you need them. I've been eating a whole food plant-based diet since 2021, and I've lost all of my excess weight, close to 80 pounds. What do you think could be causing this, and should I be worried?
Yeah, so when you have what we call postmenopausal bleeding, that is a concern, right? So what that means is that you've gone your 12 months, like she mentioned, she's in 2 years of no periods, and now she's having this bleeding episode. So absolutely, especially when she speaks to having endometrial lining, which is, if you look inside the uterus, there's a lining, right? So as you were having menstrual cycles throughout your life, so as the hormones cause that lining to prepare for potential pregnancy, it gets thicker, and then if you have no pregnancy, it sheds, and that's what's occurring. There's literally this really, it's like a symphony of hormones that cause all that to happen. Postmenopausal, you should have a decline in the estrogen and progesterone, and you shouldn't see that growth, right? And then you shouldn't see that bleeding unless there's something else going on. So I hate to say be worried, but I would be vigilant and absolutely act upon that. So I appreciate that you had the ultrasound, but your doctor will probably want to be doing more additional things like endometrial biopsies and things like that, where they go in and check that tissue to make sure there's nothing growing there that shouldn't. So I would be very proactive in this kind of case.
Thank you. I
Yeah.
think that's what she's doing. This is from Melissa, and she says, can you please ask Dr. Marbas for the ways you can combat weight gain during menopause? I eat whole food plant-based. I exercise 4 to 5 times a week, mostly strength training with some walking. I'm struggling with weight gain in my midsection, which I never had a problem with before.
Yeah. So this is exactly, it's really interesting how things really shift, because I noticed that, 10 years ago when I first went on a plant-based diet, I mean, I was eating the same, but things absolutely shift. I can't eat as much as I did before, because I think there's just natural decline in your metabolic rate. So what I would suggest is start looking at what you're consuming, right? So if you're eating more often, maybe because you're hungry after workouts, just pay attention to are you snacking when you're not hungry? Because it will come down to that. And then actually increasing your protein rich foods, that will actually help decrease your cravings, and it'll support your muscle mass growth. But there's going to need to be a shift a little bit in probably what you're consuming and when you're consuming it.
Yeah. Okay. Okay. I'm going to go look for some, but those were the only ones that were previously submitted. So let me go over to the chat. Ah, here's a funny one. How to get rid of granny flaps, the flapping arms, the melting triceps. I love that. I never, we call that, I used to hear them called Hadassah arms because you would
Hadassah.
wave and the arm would just continue. I think I have a little bit of that, huh? You wave and the arm continues to wave.
Right. So, of course, this is a cosmetic issue, which some people will find it really frustrating. If you had rapid weight loss, right, or you lost a significant amount of weight, there may be some tissue there, right? You'll see that the granny flap occurring. But really, is this going to be let's build some muscle, right? So if you want to fill this up with muscle, and so that would be starting to do some upper body resistance training. And there's a varieties of way to do that. So again, I would, Maxine from Fit Vegan would be a fantastic resource as well. But just understanding that you're going to need to build muscle. And if you've lost a substantial amount of weight and there's excess skin, that is not going to be, unless you surgically remove it. Many times you'll get to a point, especially if you're many years out from losing dramatic amount of weight. One of my patients lost 350 pounds on a whole food plant-based diet. She had significant skin, folds to deal with. And so those are just some things that you need to be aware of. And those them themselves can actually cause some issues, infections and different things. So that's where we're at. And then as we age, the skin, the collagen things shift. And also just accepting our bodies for the way they are, right? And so if that's bothersome to you, and that's fine, but it's really frustrating when these are amazing, beautiful humans, and they're so fixated on one particular aspect of how they look or something because they don't feel like society will judge them well. It's just a matter of really loving ourselves and the skin we're in, and understanding that you the being is more important instead of what we're seeing. But I appreciate that this is society and the way we live in, but we have to shift how we care and love ourselves first. Not that that person doesn't, but I just wanted to say yeah.
I remember I haven't watched TV honestly since 2018, but when I did, there was a show, I think it was called Skin Deep, and it was for cosmetic surgery for people that have had extreme weight loss. And man, I mean, it just looked so painful, like the
Yeah.
procedures. It just didn't seem like a cakewalk to have
No.
skin removal surgery. It seemed like a
And
kind of a big deal.
yeah, and it can be actually life threatening. I mean, there's some of these things that, yeah, as you said, like they could get infections and different things, but depending on the amount of skin that you need to remove, it can be, again, obviously that's not my specialty, but you absolutely can have a lot of struggles with it.
I knew somebody that actually had to do it because of infection because he had lost so much weight. The skin
Yeah,
was kind of like
growing.
buckling, and he had to get it. I think, what do they call it? There's a word for that, but not the GERD. What's the word?
A panus, a
Yeah,
panectolectomy or something.
because of the infection. Yeah.
Yeah.
Wow, that's amazing. Like that they can even do that. Okay, so Heather would like to know, how do you identify if you're insulin resistant?
There's a few different ways. You could test, there's a calculation called Homo IR. So it's HOMA-IR. Just Google it, it'll tell you what you'll need is a fasting glucose and a fasting insulin done at the same time. And that'll give you an idea of where you're insulin resistant or not. There's also additional labs you can get done at Quest or LabCorp. It's just an insulin resistance score. And then they use your lipid panel to check that. So there's going to be a few different things. The other thing you can look at is just a fasting insulin. So if it's less than 5.5, you're doing pretty good. If you notice that your blood sugars are also, if you're fasting, blood sugars are always above 100, I would probably say that you're probably insulin resistant. And if you're not insulin resistant, well, I'm be curious why your blood sugars are staying above 100 in a fasted state. There may be some other things occurring there, but for the majority, those are the things that you can look at, especially if you see that your triglycerides are also really high. That could be an indication of insulin resistance. I also want to share also what's one thing around triglycerides is that sometimes when I see patients losing weight, they get really concerned because suddenly their triglycerides will bump and they'll see some things. Remember, triglycerides are part of that fat storage, right? So as you're releasing fat and literally losing weight, you may see a little bit of a transient elevation in your triglycerides, but it'll typically resolve itself. But those things shift as your body is shifting in its composition.
Thank you. All right, the next question is from Marilyn. How do you know if you need to take hormones? I've been going through perimenopause for 3 years. I'm always having a light period.
Hmm. So I guess it really depends if you can absolutely still take hormones even if you're in perimenopause. So let's say that you're really suffering. This is more of a matter of symptom management. And if you're feeling that you need to have this done because it just feels like a quality of life. If it's just a matter of, the period, you might want to speak to your gynecologist to do an exam and make sure everything is okay. But honestly, it's more of a symptom management decision versus, oh, I need it. There is evidence, however, though, when you start your hormones within 10 years of menopause onset and you're under the age of 60, there may be some significant benefits, including heart health and brain health and bone health, and longevity. So it's really interesting research that's coming out now. So there's a lot more around this conversation, I think, that needs to be had, one in just the general public, but even in our plant-based space as well. And I'm actually working towards my menopause certification because I get so many women. This literally is the bulk of my patients, like 80% are women, and they're in this middle age bracket. And having going through this myself, I really want to have the information. And I'm actually doing a menopause workshop tomorrow for the Healing Kitchen members. It's which Brittany and I, by the way, Brittany had her baby. It's a beautiful little baby, Paul.
Yay.
So,
Well, she named it Paul.
congratulations.
I told her she should name it Rudy. Not yet him, Rudy Giroudi. Get it?
Rudy. Oh my goodness. Oh, that's cute. But yeah, so that is such again, as research changes and understands, like, we need to be open to shifting our maybe once belief systems about what we should be engaging in or opportunities. And yeah, the body does its amazing thing. It's not a disease, menopause, but it is a shift that occurs that can be quite life altering quality wise for women. And it's okay to talk about it. There's no shame in that.
Nice. Okay. All right. This is if I build muscle, I'll look like the Hulk. I don't if that's a female. I don't know very many women that look like that
You
without
know, you're not going to look like the Hulk. I mean, you're going to need to take probably testosterone and just be in the gym 5, 6, 7, 8 hours a day. I guarantee you won't look like the Hulk. It's just not going to happen.
Nice. Okay. Tiffany says, I've heard you mention before that you saw improvement in patient hair thinning once vitamin D levels reached a certain number on labs. What was that number again?
There's two things that I would pay attention to when you're looking about, well, three. If we're going to be talking about menopause is actually one of the side effects can be hair thinning in some women, especially it's probably more genetically driven. But two is iron levels, making sure your ferritin is above 50. And three, you want your vitamin D levels minimally to be above 30, around 30 or above, but probably closer between that kind of a sweet spot between 40 and 60 would probably be the most metabolically best place to be. I guess you want to speak to it that way. Yeah.
Okay, cool. And we have Monica says, is magnesium supplementation safe or recommended? I felt it helped me with sleep, but I'm not sure if it was the placebo effect.
No, actually, magnesium absolutely can be very beneficial. So, magnesium glycinate is a really one that doesn't have that GI side effects. So, yeah, I would say upwards of 400 milligrams daily can be very beneficial if someone is struggling to sleep or they're having, let's say, muscle spasms, or if you're exercising a lot and you're uh, noticing that you're having muscle spasms or muscle soreness or struggling to sleep, magnesium can have a profound effect.
Nice. There's a question, do you take insurance? And maybe you can tell people where you can see them.
Yeah, so I don't take insurance. I'm a cash only practice. I jumped into that swimming pool or ocean well, for a year and a half trying to get this figured out. And it is because I'm licensed in so many states. There's literally thousands of different insurance policies. So I only accept insurance. However, I can't provide you what's called a super bill. And it's basically a receipt of the visit and you can submit to your insurance. So if you have out of network benefits that would cover that, or if you have an HSA or FSA, many times that can be utilized towards that, unless you're in Medicare. Medicare is very strict about that. So I am not part of Medicare, so I can see Medicare patients, but they cannot submit for reimbursal because the services I provide, Medicare enrolled providers also give. So anyway, there's lots of rules and regulations. So yes, you can see me at drmarbas.com. And if you just scroll down to the bottom page, you can request an appointment and we'll reach out to you.
How was Dr. Ornish able to get his program approved by Medicare? That's amazing.
Yeah, well, that was a 16-year process, right? So he wasn't being covered under traditional charges that were already listed. They actually created special, codes for his program, but it took him 16 years to prove it and to get it covered. Yeah.
Wow. Well, good that it is, though.
Yeah.
There may be hope. Jaya says, I'm vegan, whole foods, 75% raw, 25% cooked with green smoothie. Why is my vitamin D 10 and my thyroid 7.2?
Okay, so vitamin D, you'll need probably supplementation. So remember, vitamin D is taken and converted in the skin to its metabolic active form. So if you're not in the sun enough, or you're not consuming vitamin D enriched type foods, I would take a supplement. And so I would start there, probably with the 2000 international units daily. That'd be number one. Number two, your thyroid, you want to check is make sure you're getting iodine. If your iodine is low and you need to check it in a 24-hour urine collection, that's not fun, but the blood iodine is not an accurate measurement because it fluctuates during the day. So what you need to do is actually do a full urine collection. If your iodine is low, there's different ways naturally you can do that, but you want to be sure you're at least getting 150 micrograms mcgs daily. You don't need more than that unless you're pregnant. But that supports your thyroid health, which would allow your thyroid to produce the thyroid hormone, and then the TSH will drop as you get back into that normal range. So remember, there's this negative feedback loop, right? So the pituitary releases TSH, thyroid stimulating hormone, saying, hey, thyroid, make more hormone if they notice that the thyroid hormone is low. So it may be an iodine issue. Otherwise, you can also just to make sure that there's no autoimmune component going on, such as like TPO antibodies or thyroid antibodies that you can check to make sure your immune system hasn't attacked itself. But most of the case, when I see someone who's very, very healthy, they're eating a very strict, healthy, whole food, plant-based diet, salt, oil, sugar free. Remember, salt typically in most Western countries, you'll see iodine attached to salt, right? So you get iodized salt, and that's where they get their iodine in most cases. So if you're doing salt-free, that might be the issue, is that you're not getting enough iodine.
Okay, great. Thank you. Sandy wants to know if you treat PCOS. She's
Mhm.
on a patch for hormones, had last ovaries taken out when 47. She's 57. Now she still takes, I guess, the patch.
Mhm. Yeah. No, absolutely. We can definitely speak to the PCOS piece. Yeah, for sure.
Okay. And Rhonda says, I'm taking 400 milligrams of progesterone to help me sleep. It hasn't helped. Do I need to take it anyway?
No. All right. And so if you're finding that the progesterone is not being helpful, there may be other things that would benefit you as well.
Yeah. A lot of times, I mean, I don't know if this is her case, but all the people I've known that have trouble sleeping, they don't exercise during the day. I
Mm,
exercise so hard. Like when I hit the pillow, I can barely even, like, we always try to watch a show and I'm like, never get
yeah.
to see it, you know?
Yeah, because you have an amazing sleep drive, right? So you have to think of it as like a braking gas, right? So you need to push on the gas to go to sleep. You need to up your drive. Exercise is a big one, getting up at the regular time. Yeah, so there's lots of things that you want to do is increase your sleep drive.
Yeah, that's really interesting. What do you do for exercise, Dr. Marvis?
I love, well, one, I was running until menopause hit, and then I started having these weird joint pains. That has all gone away now, but I walk upwards of 8-9 miles a day. There's resistance training. Yeah, I need to do more kind of yoga, stretching. I just have to figure out where to put it in my day. But yeah,
Yeah.
those are the two things that I do mostly.
That's my favorite. It's the resistance that I need to do. And I have been resisting resistance training, but I just find it's just incredibly boring,
Right.
compared to like the fun stuff like the cardio and even I love yoga though. I mean, my gosh, I just like my favorite.
Maybe put a weighted vest on while you do your yoga.
Yeah. Oh, really? I don't have
Yeah.
a weighted vest, but yeah, that's interesting. Yeah.
Mhm.
So if you have any questions, type them in the chat. I'm not seeing any. I can give you some of the questions from the other doctors that we have a backup for. Let's
Sure.
see, let's see if we have any general medical questions or anything like that. Well, I'm curious where most of your patients come from in terms of geography.
Geez, I've seen patients in every state so far. I would say the majority of my patients are in California, and probably surprisingly, I get quite a few in Connecticut, in Ohio, Texas. Uh, yeah, those are probably my four top. It's strange, huh? Great, Connecticut of all places. Yeah.
Can you see international patients as well that
Yep,
aren't from the
I've
United
seen folks. Yep, I've seen folks from Australia and Canada, France, UK. I can't order labs or medications, but I can certainly help direct them where they needed to go.
If people live in the area that you live in California, are there any in-person options?
No, I don't see patients in person. It's just telemedicine at this point.
Do you miss that though?
It's been so long. I've been doing this now for 8 years. And I like the freedom that allows me to see patients telemedicine so I can be anywhere and do anything. We're actually going to be selling our home this summer after I'll have two children have gotten married this in the last and within 2, 3 months. And we're gonna go RVing full time all across the country. So we're really excited. We've been wanting to do this for a long time. So we'll have three kids in 3 different states and just visit our national parks, and I'll still see patients and stuff, but it's gonna be a lot of fun.
Well, that's cool. You can do that from anywhere.
Yes.
Yeah. My Instagram froze, so if there's questions there, unfortunately, I can't see it. That does happen. But okay, so I can see the other two platforms. Now I'm seeing a question on Facebook from Myra. YouTube's the best place, guys, because that never freezes because it is a YouTube show. I've been whole food plant-based, nope. I don't know what that means. I'm sure you mean plant-based and SOS free whole food plant-based since 2004, SOS free since 2015. I just developed moderate severe diverticulitis that was shown in a CAT scan. How is this possible if I'm 65 and exercise regularly?
She has so two questions. I guess I this is where it gets a little more nuanced is was it just noticed that you had diverticulosis, or were you symptomatic? They did a CT scan and found that you had diverticulitis. So if you had symptomatic diverticulitis, like what caused that infection, I don't have a really good answer for you. I mean, you're obviously doing everything right in the sense of food and exercise, but if they just happen to notice that you have outpouchings or diverticulosis, meaning that's not the itis. The itis is an inflammation. The osis, it means that you have these little outpouchings. You may or may not see them, but if you already had them from a previous way you ate, that is, I mean, things happen. Remember, the plant-based diet is an amazing tool, and it keeps people very healthy, but things still happen and we don't always have the answers, unfortunately. But you've decreased your risk for so many other things. But again, I don't know where that is. There's a few different things that could be going on.
Great, thank you. Rich would like to know, what are the best and worst foods for kidneys to keep them and to keep them strong?
Yeah, so you want to eat more plants, right? More rich fiber rich foods, and remove the animal products, the very ultra processed foods, right? So even though you may eat something that's quote unquote vegan, or they suggest that it's plant-based, but if it's ultra processed, that's not going to be healthy for you either. So the kidneys need a anti-inflammatory whole food plant-based diet. So those are the things and if you do that, you'll be great. If you are stage 3 or 4, or if you've ever been told, oh, like your kidneys function is so compromised that you might notice an increase in your potassium. If you start increasing potassium rich foods, which come naturally in plant foods, you'll want to speak to your nephrologist about that, because there may be some gentler ways to move into that, and some things you need to pay attention to. Outside of that, you just need to do that and drink plenty of water. Make sure you're staying well hydrated. I don't think people quite understand the consequences of not drinking enough fluids throughout the day. And yes, you're eating, water rich foods like fruits and vegetables. But again, many times people are walking around dehydrated, and it's quite phenomenal what goes on in the body when you're dehydrated. You feel tired and fatigued, difficulty focusing, you're sluggish. It's just, do yourself a favor and drink some water.
Yeah, I'm drinking right now.
There you go.
So Susanna would like to know, Is it genetic that we will follow our mother's time of menopause, or is it individual? As the mother of a 32-year-old daughter, how can I set her up for a smoother menopause that I had? Thankfully, she's eating a whole food plant-based diet 95% of the time.
Yeah. And from the current literature, it looks like for the majority, that's a good indication, right? Is looking at what your mother and grandmother did. So for in my case, however, there were other surgical interventions, but when my grandmother and mother, they had horrible menopause symptoms. And of course they didn't eat the way I did, but they weren't severely metabolically compromised, as far as like diabetes or anything like that. But I was a little bit worried about what was going to happen, and some of those things did happen, but not as severe. But yeah, so to look at your history and just prepare your daughter for those type of things. Of course, we're all on our own individual journeys, but it is a good ballpark figure to look at.
Thanks. Kyle says, can you comment on creatinine use for brain, bone, and muscle health in menopause?
Mm, yeah, so it's interesting that it actually has got thousands and thousands of studies, and it's actually a pretty safe supplement. So if you want to, consume creatine, you absolutely can. And yeah, you just want to take it. I mean, I think it was up to like, if I remember right, 5 grams a day you can actually do. But yeah, the utility of it could be quite significant for some people. So I don't have a problem with it.
Thank you. Monica says, I'm 51 in mild perimenopause. Is HRT recommended as a prophylactic to avoid dementia, osteoporosis, heart disease? How would I convince my MD who says menopause is natural?
Um, so menopause is natural. And I used to say the same thing. And I will tell you, I used to like before I fully understood the breadth and depth of what's occurring here during this transition. Um, it's like it's just menopause. You'll get through it, right? It's just the way it is because of the WHI. So when I was in my training and newly minted doctor, the Women's Health Initiative research really cemented, the fate for HRT prescribing for decades, where women were being withheld really potentially one quality of life enhancing medication, but also changes in, it could have helped their health. So I think you maybe want to speak to maybe a different physician if your doctor's not willing to look at the data. There's an organization called well, it was the North American Menopause Society, but now it's called the Menopause Society. If you go to menopause.org, they have a statement, 2022, looking at the research and just understanding you're absolutely in the perfect phase of life, depending on your other risk factors. If you have a history of breast cancer or some other things, heart disease, it's a more nuanced conversation around, and you still may decide to go ahead and see if you can get some benefits from what they call menopausal hormone therapy at this point. We're kind of moving away from HRT, because HRT means that you probably, if let's say you had early ovarian failure and you were under 45, or you had surgical menopause, because they removed your ovaries, that hormone replacement means you're getting hormones replaced at the amount that you were in this premenopausal state. And so menopausal hormone therapy is really, let's look at the you need at the lowest amount you need to really mitigate symptoms. That's how they're looking at it right now. However, the more recent data is showing it can have an effect on longevity, it can have an effect on your brain health, your bone health, and heart health. So there's some definite things that you may want to consider involved in. And I've been so convinced with the research that I chose to, use estrogen. I still have a uterus and progesterone, protect the uterus now until I see different evidence. And it has made a huge difference. I didn't realize the other symptoms I was having. I feel like I was in my 30s. And so I don't know. And it's at the lowest dose possible. It shifted my lipid panel from, like I said, my LDL was in the lower 100s. It went from 70 to above 100. Now it's back down to where it needs to be. I don't know. My joint pain all went away. That just suddenly appeared 8 months ago. I was like, what is going on? And it wasn't because I had changed my workouts or anything, but all that is shifted. I'm sleeping better. So that's just my own personal journey. And as so many patients the same way, they come almost ashamed to ask, because I've been eating a plant-based diet. Why don't I feel amazing all the time? I'm like, it's you're a body, you're a human, things happen. And we have to be open to this conversation. There's no need to be medication shaming people, because that does happen regularly in this space. And it's unfortunate. And I'm trying to kind of be a light in that. It's like, hey, there's another way to look at this. Let's broaden our perspective. We're always telling people, broaden your perspective. And this is in case one of those. So I think the evidence is pointing that it might be something worth considering. And again, this is a personal decision and it needs to be based on your benefits and risk and a conversation. And then you make an informed decision. It'd be the same thing if you went to a doctor and you had high cholesterol and they said, oh, you need a statin and you're going to be out the rest of your life. If they withheld the information of going on a whole food plant-based diet, right? Looking at lifestyle interventions to see that dramatic drop that we all see when people consume healthier foods. So it's the same idea. I would never inhibit my patients from, seeking all the opportunities, because who am I to make that judgment? They come to me for guidance, and I need to give them everything that I understand and know. So that's how I choose to proceed with that.
Thank you. Okay. There we go. Okay, here's a question. Is there a book that you can recommend on a healthy approach to menopause?
Hmm. There's a new one, Menopause Brain, by Lisa. The last name has left me. Menopause Brain. It's a great one. She's a neuroscientist. She also promotes a plant-based diet, which is amazing in this book. But she really speaks to the mental and what's going on neurologically. And it was a really great book. In Audible, if you like the Audible, it was great too. That would be the first one I would recommend. I think there's some other ones more. I know Dr. Northrup, what was that book called? I think it's just called Menopause. Um, and she kind of speaks to how we look at this as a flowering, right? So we went through in our younger years, many women were working and raising a family, and now menopause is a place of, I like to consider it like you were a caterpillar. Now you're in this perimenopause is your cocoon and then you emerge as a butterfly, right? Because we have a different perspective. I feel like you're wiser, obviously, and you just have it's a time of introspection, right? It's like, man, you've given so much for so many others, so many years, women sacrifice. It's time to take care of yourselves, right? And I think it's a time to think about us as emerging as butterflies, honestly.
Thanks. I can't remember if I asked the progesterone cream for sleep question. Did I? Because
I think so. The 400 milligrams, was that one?
from Gina, do you recommend progesterone cream for postmenopausal women for sleep? I'm sorry if I don't.
Yeah, sometimes women, the progesterone will help, but sometimes the estrogen will help as well if there's no contraindications to it.
Nice. Colleen says, what would happen if you haven't gone through menopause? I've never had a hot flash.
That, well, depends. So just because you never had a hot flash doesn't mean that you haven't gone through menopause. So if you've gone 12 months without a period and you glided through without even as so much as a hint of a hot flash, amen, this is fantastic. You just keep on trucking, right? So but if you want to be more engaged on the longevity components and looking at the more recent research and being kind of more, I like to also be, I'll try things. So if I read something about, let's say, turmeric and ginger, because it's a great anti-inflammatory, I'll take it and see what happens. Or, I'll put on a CGM. I like to test things and see what's happening because I just find I learn things, I ask questions. It's just fascinating for me. I'm always learning. And so, but if you're fine, you're doing well, you don't necessarily need hormones. It's not for everybody. Absolutely not.
Okay, thank you. So I see one more question, but this isn't about menopause, but I
Yeah.
think you'll know the answer. It is from, it was on tinnitus, or is it tinnitus? It's, I'm sorry, there's just so, here we go. What suggestions do you have for a high light pitch noise, tinnitus in the ear? I only notice it when it's quiet or at night.
Oh, yeah. So when I was in the Air Force, lot of tinnitus, right? So you'll get this humming sound, or you'll get a like you said, like kind of like that high pitched static sound. What you may want to do is have some type of white noise in the background. I haven't found that there's any and I've asked ENT docs, neurologists, I've looked at the research, unless there's something more recent going on, any cure for it. But many times people, it's almost like a mindful approach to it too, but they come on like, man, I don't even notice it during the day, right? Because it's probably still there. But when it's quiet, it's when it gets your attention. But you might want to do white noise, like a fan or some static noise in the background. That may help drown that out so you can get some sleep. But yeah, unfortunately, there's nothing that I'm aware of medication wise or lifestyle interventions that helps it.
I know this is going to sound weird, but Dr. Goldhammer said there was a patient that they got rid of it after fasting. I mean,
Oh, well, it's worth a shot.
might be worth a try. Well,
Yeah,
thank you so much. This was a really interesting topic, Dr.
yeah,
Marbas.
yeah. Thank you.
It's so
Appreciate it as
fun having
always.
you. Oh, my pleasure. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow at 11 a.m. Pacific time for Chad Monfiglio. He is from Betar Cancer Genetics, and he's going to talk about how cancer can now be diagnosed with a simple blood test for those that don't want or cannot have biopsies. I heard about this from Dr. Sunil Pai, who attended a conference on this, and it's a fascinating topic. But first, come back in about a half hour for Dr. Andrew Freeman. We're going to be catching up with a plant-based cardiologist. Take care, everyone. Thanks for watching. Bye-bye.